Well, good afternoon and welcome everybody. Gunalchéesh, Háw'aa for joining us for today's lunchtime chat with Tlingit and Haida. For those of you who don't know me, my name is Háw'aa Richard Peterson, and I serve as the president of Tlingit and Haida. The lunchtime chats serve as an opportunity to share information with our tribal citizens on our programs and services, as well as government and administrative activities. Today's lunchtime chat has been brought to you, and it's been a little while since we've had one of these, and this one's a really special one I think that's really important to all of us. And today we're going to be talking about culture heals, and it's our online addiction help. And today we have with us, I'm really excited to be joined by Dr. Tina Woods, who heads up our new Community and Behavioral Health Services Department, Dr. John Fitzgerald, who we work very closely with, and then our family caseworker, Lisa Pennoyer. Dr. Woods, do you want to introduce yourself?
Sure. Thank you, President Peterson. It's good to be with everyone today. My name is Tina Woods. I am the daughter of the late Maria Shechnikoff. My mother is originally from St. Paul Island, and I'm also the daughter of the late Juan Duenas Leongro, my father's Chamorro from the island of Guam. I'm a licensed clinical psychologist, and I am just pleased to work here at Tlingit and Haida and to serve our tribal citizens through our CBS Healing Center. So good afternoon, everybody.
Thank you. Dr. Fitzgerald?
Yes, really glad to be here. John Fitzgerald. I'm the son of George Fitzgerald, the late Gene Fitzgerald. I have the son, Aaron Fitzgerald, who's worked very closely with me on this program. I am the developer of Culture Heals and also what is known as the 5 Actions program that is also existing in New Mexico. By way of training, I'm a licensed professional counselor. I've also done research. I'm on faculty in psychiatry at Oregon Health and Sciences University. I reside just outside of Portland, Oregon. I have spent the last 2 decades studying addiction and treatment and trying to take that knowledge and put that into this program that I've been so grateful to be able to work with the tribes on, and it's really been a collaboration. So I'm really glad to be here. Thank you.
Thank you. Lisa?
Hey, good afternoon. My name is Lisa Pennoyer. I am the family caseworker with the Behavioral Services. I am Sagwedi. Our family is from Cake or Eagle Killer Whale. My grandparents are the late Charlie and Annie Johnson from Cake, and my mom is Flora Huntington. She still lives with us here in Juneau. And I am just really excited about the opportunity to be part of this. I appreciate Tina and John including me in this this wonderful adventure.
No, thank you all for introducing yourselves. You know, again, this is such an important area for us to focus on as a tribe. You know, behavioral health, addiction recovery, you know, so much trauma that it's hard to really focus on any one thing. And I know this has been really important to us. And you know, Culture Heals has been adapted to meet our tribal citizens where they're at physically, mentally, emotionally, and spiritually. And today we're going to walk our participants and those tuned in through the online platform and to learn about the many ways that Culture Heals can be used. Dr. Woods, can you give a little background on the Cultural Heals program to explain where this idea came from and what it seeks to provide?
Absolutely. And then I will have Dr. Fitzgerald talk a little bit more. So Culture Heals was adapted. Dr. Fitzgerald worked with us from a foundational program, 5 Actions out of New Mexico. And the reason why we became interested in adopting this here at the tribe, we all have this really, this shared experience during the pandemic. Many of us were experiencing, and still some experiencing, social isolation, which has increased a lot of behavioral health issues such as anxiety, depression, just a sense of loneliness, and maybe coping with substances and other addictions. And so we also know that across the nation, there's a huge shortage of behavioral health services. And we felt that this was an opportunity to provide online, using technology to provide online addiction education treatment and more. Education is really important when it comes to somebody wanting to seek help. And it's a doorway for somebody to do it in the privacy of their own home, to learn about maybe some of the things that they're experiencing. Not only our tribal citizens, but also family members that may notice something in a loved one and they want to help them seek help. And so Culture Heals is paired with our CVS Healing Center. If somebody logs on to Culture Heals in the middle of the night, we have a 24/7 crisis hotline that they can call at that time, and one of our staff will contact them during the next business day to provide them support and help them seek the help that they are looking for. And so those are some of the reasons why we wanted to engage in this platform. We also want to acknowledge that we have tribal citizens, over 33,000 tribal citizens across the nation. And we know that our leadership wants us to meet our tribal citizens where they're at. And it's such a convenience if somebody can log on. It's mobile friendly if they can log on in the privacy of their own home and discover ways that they can seek help and at their own pace. Dr. Fitzgerald, do you want to add anything to that?
I can just say a little bit. Part of the origin came from when I was doing research throughout the United States, looking at prescription drug abuse. And there were so many communities where people needed help and there just simply was no treatment programs available, or if they were very small and they had a lot of waiting lists. So that was the initial kind of impetus for me saying, we should be able to use technology to kind of bridge this gap. We've known from a lot of research that less than 10% of people who could benefit from some type of an intervention actually receive care. And there's a lot of reasons for that, whether that's barriers around insurance or simply the treatments not being available. When you look at the technology, the proliferation of smartphone technology really started in around 2005, and it grew all the way up to about 2015. And at the same time period, we also saw the emergence of broadband or high-speed internet. So the technology, the ability for us to build a platform with the kind of tools that we have included and collaborated on around Culture Heals is really fairly new. It really started, the technology and the ability to reach out to populations wasn't really even there till around 2015, 16. So the other thing that I think also was this ability to collaborate around content and to be able to address all addictions as a package, as well as the underlying drivers, and be able, as you said, to meet people where they're at. A lot of people, I think, we talk about this addiction as a motivational issue because a lot of people don't seek out help for a variety of reasons. So the idea behind this type of a program is it's very low-hanging fruit. There's really nothing to risk by going on and checking out some videos and looking at some content. There's a lot of stigma around addiction that we're trying to remove. So I have absolutely been so grateful to work with the tribes and everybody on this collaborative effort, and it's continuing. We're going to continue to adapt this program to meet the needs of everybody within Tlingit and Haida.
So, many people struggle with addiction. Can you talk a little bit about how this program can help?
Lisa, I would encourage you to comment on that, and then I can also.
Yeah, I would gladly. This program was developed, like you said, by Dr. Fitzgerald, and he came to Juneau, and it was really beautiful as he came and talked to our people, and he talked to them directly, and he talked to their hearts, and he heard their stories. And this Culture Heals has little snippets of people that you'll recognize in your community, elders, young people, people that work for Tlingit and Haida, telling their story, sharing that they're not perfect. None of us are perfect in life, and that we all heal slowly, but we all heal. And I think it was just really beautiful that when you look into this, you'll get a 3 to 5 minute video of somebody sharing, their hurts, but also their successes and the journey that they went to that success. So I know that it's a scary thing to do sometimes, to say, I'm hurting and I need help. But like Dr. Wood said, this is a private platform where you can get on your phone, you can get on your computer and seek answers that you may be looking for.
Thank you, Lisa. And, what I will say about how this program can help people if they are ready to seek help is just being able to learn a little bit about what they're experiencing. Often when people need help, there is a stigma, as Lisa had described. There's stigma, there's shame and guilt that often keeps people sick in their addiction. And so education is supposed to help us understand perhaps what we're experiencing, how the brain is hijacked from something that may be, that we may be battling. But also Culture Heals really looks at the underlying issues such as adverse childhood experiences, historical trauma, intergenerational trauma, colonialism. These are all things that our people have experienced. And so we really, we have to be able to understand our past in order to move forward. And so those things are acknowledged and validated as a part of the history. This program can help because when somebody is ready and they feel ready to reach out, like I said, they can talk with someone in the middle of the night when we're not able to answer our phones during the day at the CBS Healing Center. And then with given permission, we call the individual back. If that individual is ready to enter residential treatment, we have case management through the Healing Center. We have clinicians on call every day of the week. Sometimes the thing between an individual and a bed that maybe their family has identified for them to go to is an assessment. And so this is a doorway. This is a doorway. I'm not saying it's easy work. There's sometimes we are jumping through hoops to figure out how to get someone the help that they need. And that's probably the powerful engine about this platform is, it's a doorway. And together we can help people find the services that they need. While we're located, our healing center is located here in Juneau, we acknowledge that we have tribal citizens that live across the nation. And that's important to acknowledge because Protocol, our crisis response center, has a footprint across 48 states. And so what happens is, they're familiar with the services not in Alaska. And so through case management and our providers, we help make those phone calls. We help, as we would do in our tribal communities and as family. We're going to hold you up. We're going to do a warm handoff. We're going to walk aside you. Sometimes half the battle is just understanding the language to use when seeking help. So I don't know if Dr. Fitzgerald has anything that he would want to add.
I think you really covered it nicely, Tina. It's not a replacement for treatment, but we're trying to remove all of the barriers so that we can provide access to a variety of tools. Some of it's educational, some of it also speaks more to the actual interventions. We've tried to take the content and keep it all into 3 to 4 or 5 minute videos, very engaging. We've had a variety of different assessment screening tools. I know you're going to kind of walk through some of that, so I won't go into more detail, but yes, I'll pass it back to President.
Thank you. We talk a lot about our cultural values as a tribe, as a people. Can you talk a little bit and provide some of what the values that are important to the Community and Behavioral Health Services Division are at Tlingit and Haida, and as well as the Cultural Heals program?
Sure. Actually, this slide right here, when I look at just the image of all those hands holding up that totem pole, one of our tribal values here in Southeast is to hold each other up. And what we really aim to cultivate in our CBS Healing Center is every one of us as providers and employees, we are expected to live these values and to bring our true selves, living these values in session with our people. We aim to hold our people up. We aim to give our people the respect and to acknowledge and to destigmatize the shame and the guilt of some of the things that they may have experienced in their past that is holding them back from being the best version of themselves. We really hold them up. We speak with care. We speak with care to ensure that our tribal citizens, program participants, and family members feel heard. So we listen well with respect, and we take feedback. If we have a tribal citizen who is not getting the care that they need, we take feedback and we value that, and we try to continue to improve ourselves. Our CBS Healing Center has been open virtually since November of last fall, and to date, we have a waiting list. People need help and they need it now, and our tribal values, we really try to infuse those in everything that we do. With Culture Heals, we absolutely infuse our tribal values through storytelling, through some of the brief videos that you will see from what we refer to as our Southeast Alaska collection, people sharing lived experience and, really having our value of being strong and having courage. Because when we see ourselves through each other, we feel less shame and guilt and maybe more willing to help heal ourselves. Because the last thing I'll say that we cultivate in our healing center and in Culture Heals is that we have to do our own work. So our providers here create space for people to heal themselves. Healing ourselves is a lot of work, and as elders have described to me, we heal for the rest of our lives. If Culture Heals and this platform can be a doorway to somebody opening that door to begin their healing journey, we have success in taking care of our tribal citizens. I don't know, Lisa, if you have anything you would want to add.
Sure. I just, I do appreciate this slide too, because, they talk about it takes a village, but right now, because of COVID, we couldn't be with our village. We couldn't be with our people. We couldn't sit together. We couldn't hold each other. And that really had a real effect on people. And I think this platform and this new program that they've created for us it gives us permission again to have the courage to step forward and say, yeah, this was difficult times, and not just COVID, even pre-COVID, there were some difficult times and some difficulties, and I didn't have my village to hold me up at that moment. But now through technology and through computers and through our phones, we are creating a new kind of village, and it's still a village because it's people. We can't do this without other people. We can't do this by ourselves, but together as a village, we have courage to acknowledge that there's an issue, but we also have the courage to be able to accept healing. So thank you for that.
There's so much I want to say to this, and it, for those that know me, know this is really personal to me. I'm closing in on 2 decades of being clean and dealing with my own addiction. And that's not something I hide. And I think sometimes people are shocked to hear that. But, to be Tlingit, to be Haida, to me, is to be human, and we make mistakes, and it's in our culture that we can find that healing, that we can rebuild ourselves. And I preach about this a lot and talk about it. It's, again, something so personal to me, but I dare say I don't know that I could identify anybody in our community, in our people, who aren't impacted or touched by this, whether it's their own struggle with addiction, whether it's a friend or a loved one. It's really hard, and we're trying to deal with, we talk a lot about historic trauma, all the things that impact us, and they're real. But when we really fall back on our values and we hold each other up, that's where that healing starts. Because addiction, is so wrapped in shame. It took me so many years to be able to talk about it openly. Now, it's like the door is wide open to my emotions and to sharing it. But there was a time where I carried so much guilt and shame about it. Even when, I'd outed my addiction, it was still a struggle to talk about. And, if you're really going to begin that process of healing, you got to first start with just forgiving yourself and letting and accepting the forgiveness of others. And that's what that holding each other up when we fall on our values, we tend to do. And I always think of, the late great Dr. Sobolev. He always said, when we know who we are, we don't hurt ourselves. For me, I tied that back to when you know who you are, you're living your cultural life, your cultural values, you're not hurting yourself. And, I can remember turning and working, with Stan Marsden on a totem pole project in Kasan. And, he had dedicated his life and his work to addiction and recovery because he lost his son, and it was so personal to him. And that's where the idea for me of cultural heals began. And I know so many others had that same kind of epiphany when we get back to our culture, when we're connecting to our people, connecting to our values. That's when we start to know who we are. It's when we start the process of forgiveness, and it's such a deep issue. It's not just your own, whether we like it or not. My addiction didn't just affect me. It wasn't just myself I hurt. It's your loved ones, it's your friends, it's your family, it's the people who look up to you, and people did look up to me. And here I was struggling and made that shame even deeper. But it was my community, it was the people around me who decided to hold me up. And so, when we talk about meeting our citizens where they're at, and I'm so in love with this platform because it really removes all the barriers to, like what Lisa was talking. This pandemic was so hard on our people because we had to be separated and isolated from each other for so long. That's not natural for us. It's not natural to our culture. This platform, removes that. I'm so proud of our staff at Tlingit and Haida who started doing innovative programming, whether it was the lunchtime chats or the elders talking circles to beading circles, to all the different ways to use this technology to connect when we felt so disconnected. And to have Dr. Woods come on board and start up this department, then for her to come and turn and say, hey, we found Dr. Fitzgerald and his program, and we think this really can be integrated with our culture. This is pretty phenomenal. It'll never be enough. Everybody in the world could begin doing the work. It'll never be enough, but it's something, and it's something where there's no barrier, whether you live in Anchorage or North Carolina or wherever, you can be connected through that online Quan, for lack of a better term, right? Our villages. And it's like building this new online Quan where we have a village of support, where whether you're thousands of miles away or you're next door, it doesn't matter. Sorry if I got a little bit long-winded on this, but it really, this is something so personal to me. And I think we have to, I think it's important for me to share that, I have my own struggles, and yet here I am, the president of Tlingit and Haida. You can recover, you can make mistakes in your life. You could think you're at the very bottom, and you can, find your way out of it. And it's by reaching out, it's by forgiveness, forgiving yourself, forgiving others, all of those things. And I think that's what this is going to offer. So, again, sorry, Dr. Woods and everybody for getting long-winded on this, but when we talk about culture heals and our values, it's so important. So now I'd like to give the floor to Dr. Woods and her team to give us a tour of the Community and Behavioral Services website, and more specifically, the Cultural Heals website.
Sure, President Peterson, I will share my screen and give a tour of the platform so that we can encourage people to sign up. But before I do that, I do want to really acknowledge something President Peterson stated, and that is this platform, this is just a doorway. This is an evolving project that requires continued attention to, because when we met with Dr. Fitzgerald, we told him people are dying now. How long would it take to build our own platform? And what John said was, let's not wait. Let's figure out how we can get it up and running. We can fine tune it. We can refine it. But for now, let's not wait. He goes, because I hear you, I hear the urgency. And so I acknowledge that, because if we were to build from the bottom up something like this, it could take years. We would, so what I'm about to share you, this is a partnership with Dr. Fitzgerald, and he has really honored our tribal values. The last thing I'll say before I share screen is that, being able to learn about addiction from this platform can actually completely transform somebody to know how to talk to a provider and say, I want help. It can transform a family who has no hope, because a part of addiction is feeling hopeless. Many people have different perspectives about addiction. My perspective is that there's always hope, and people deserve for somebody to believe that they can recover. There's always hope. They could be at the bottom of the barrel, and it starts with understanding what is happening to me. So I'm going to pull the platform up. Can you see that? The platform? Not the PowerPoint, right? Okay. All right. So when somebody visits the site, this is the page that you will come to. You can get to this page through our CBS Healing Center. And so hopefully you are seeing that here shortly. Can you see the CBS Healing Center? Yes. So through the CBS Healing Center, you can go to resources, you can get care, there's frequently asked questions. Under resources, you'll find Culture Heals Addiction, and when you click on that, it will take you to the site that I'm about to show you. So this is what you'll see when you log in. This is the front page, and what I'm going to do is I'm going to play a brief video, 3 minutes, of how it works. And hopefully, Lisa, just give me a thumbs up if the video and sound are good.
We're developing programs that aren't necessarily only place-based, but people-based.
So what makes Culture Heals really special for serving our people is it addresses addiction as a whole package, not just substance use disorders, but other types of addiction, like gambling, food addiction, technology. There are many types of addiction. And it also addresses not just the individual that is suffering from an addiction, but it also provides support to the family to help their loved one journey through their healing process. We offer 24/7, 365 days a year crisis hotline so that if you find you're ready, you know who to call at that time.
People need to hear, they need to know that you can mess up in life. We're not meant to be perfect. We make mistakes, but through our culture, through our people, we can hold each other up. We can prove that culture heals.
I think that if we dig, we all have trauma. Everybody does. And so if you're really truly wanting to heal, the power is within you. You have to face whatever it is you're going through. That would mean putting substances aside. You have to have a sober mind to be able to do that healing for yourself.
As we address addictions, there are the underlying drivers, such as historical trauma, attachment issues, co-occurring disorders. We really treat the person holistically.
There's so much shame carried in our culture right now. I think those who don't know, the language, there's shame. Oh, you don't know the history, there's shame. For so many people that have been taken away through OCS and other things, they've been raised outside of our people in non-native hands, and bless them, some really good homes, right? But they still don't know who they are, and they carry that, and they end up turning to addiction and the things that are stamped down in them, right? That seed they're carrying, and they end up struggling just like anybody else who doesn't know who they are, who don't feel connected to their culture. Don't deny yourself that healing. Don't deny yourself that love that you do deserve. We all deserve it. No human being is born undeserving of love, and people can do heinous things in this world. Everybody has a chance of retribution. Everybody has a chance to be better today than they were yesterday. And that's what our culture is, and that's what our culture will tell you. And when you embrace your culture and when you live it, you will know that you can be better tomorrow than you were today. That you can feel better tomorrow than you did today. Today is temporary, tomorrow is forever. And you have a clan and a tribe that wants you to be a part of it because you're worth it.
So, as mentioned earlier, this is mobile friendly. So you can do it from your smartphone. Inside, there's over 100 videos. And of that, we have our Southeast collection. And just notice that it's help for all addictions. And, that includes gambling and food addiction. When you go to the top of the screen, there is my account, and you can sign up. Anyone watching right now, you are welcome to sign up. And then once you sign up, you go to your dashboard, and this is what it looks like. It welcomes you because you'll type your name in. On the left side, there's a menu that you can access. On the right side, there's a reminder that we have 24/7 call line. And the box below here, upcoming webinars. Everyone's allowed to sign up for these webinars. They are excellent. Dr. Fitzgerald, along with sometimes invited guests, talks about topics such as guilt and shame, suicide. The topic, sometimes depends on what the awareness is for that month. Certainly, they talk about some of the experiences we're having during this pandemic. It's a personalized roadmap. So once you get to this section, you have a couple options. Down below, Tlingit and Haida interviews on how culture heals. If you click on this hyperlink, it will take you to the library of all the videos that were done here in Alaska, here in Southeast. And, this is a developing part of the site. But as you can see, there are topics such as how does culture heal, understanding trauma, colonialism, historical trauma, grief and loss from our perspective as Tlingit and Haida tribal citizens. When I go back to the platform, let's say I wanted to explore mental health challenges. It brings you to a pop-up box and you're allowed to click on some of the topics that you would like to learn more about. So as you click on those and you hit submit, it will take you to a little library of videos within the 100 videos on this site, mixed between the Southeast video collection and much of Dr. Fitzgerald's work. There's one on the ACEs study. When you click into these videos, you are able to watch a brief clip such as this one, and at the top under historical trauma, it'll even show you who's featured in the video. Some of these names may look familiar to you. Once you watch the video, you can hit submit because this is your platform completed. And sometimes at the bottom of these videos, there's a deeper dive. There's, if you're looking at perhaps like adverse childhood experiences, you might have access to filling out the childhood experience, you know, the ACEs self-report. And, you know, these self-inventories throughout the site are meant to provide education and give you some feedback on maybe some of the things that you're experiencing. And the idea is for you to be able to learn more about yourself so that you know how to ask for help. Half the battle of somebody seeking help is being able to articulate what they're feeling. So if you take little children as an example, little children, they have a lot of somatic complaints. I have a headache, mommy. I have a headache, daddy. I have a stomach ache. That's sometimes a sign that something's not right. They might be experiencing a stomach ache, but they might also be stressed. So think about how hard it is for a child to describe what they're feeling. Now think about it as an adult. As adults, we have a very difficult time articulating what we're experiencing. And that's the power of Culture Heals and the education around it, to be able to just explore how does my brain work, or a family member who's struggling with a loved one, being able to help decrease some of that shame and stigma by telling them, I feel like I understand you better. And so, and lastly, I think what I'll say here is, you know, within the CBS Healing Center, I want to acknowledge that we have an incredible team of providers, healers who come with such big hearts, who grew up with the tribal values of Southeast Alaska, who create space for healing. So when somebody is ready, you know, even if we have a waiting list, we do have an on-call clinician every day of the week. We have some wonderful behavioral health aides. We have our caseworker, Lisa Pennoyer. So I just want to acknowledge that when people are ready, that we're here to catch you. And if we can't do it, then, you know, we're ready to partner with other organizations to support you.
Well, thank you for that overview, Dr. Woods. We have some commonly asked questions I would like to go over, and then before we turn over to questions from our online. Cultural Heals is a free program to use. How is this possible when most of the programs of this nature are not?
Dr. Fitzgerald, do you want to comment on that?
Sure. I think, you know, the answer to that is that the program is paid for by the Tlingit Haida tribe, right? And so in some ways, that's part of what we're trying to do, is create this platform where the barrier of cost is removed, to where everybody 24/7 can access this platform and all of these resources that we're continuing to develop. But that's the reason for that. And so, yeah.
So is Culture Heals a replacement for addiction treatment?
I can take this one too. No, it is not. Again, as I said earlier, less than 10% of people actually can access addiction treatment. So it's the minority of people. So for the other 90% of people who could benefit from something, this platform offers a new opportunity. It's not treatment, it's a learning platform right now, but it has a lot of information. It can also be used by people in treatment programs. So it's not that it's not appropriate for people who are in treatment, but in some ways, it's not a replacement for treatment. And if people are using the platform and they're taking the screening tools, and they really get to some idea that they might need a higher level of care, that's part of the purpose of the platform. Please reach out, make the phone call, talk to people, get to the community behavioral services and seek that help. That is the more professional treatment.
Can you explain why this program addresses all addictions when other programs focus on specific addictions?
Yeah, and the main reason is that the brain doesn't know the difference between different addictions. Even though within substances we have uppers and downers and all arounders, and we have behavioral addictions. When a person stops one addiction, they may stop drinking. Often the brain, it's like this pathway or a river that goes through a canyon. It just finds something else to go on to because of these underlying drivers that continue to push and perpetuate addiction, like trauma and historical trauma. So we often talk about that game whack-a-mole, where different addictions will pop up. The goal of this program is to help people identify all of the different ways that people use these adaptive substances and behaviors, to help them to identify that as a package and deal with it as a package. Because just because somebody may stop drinking, if they go and they pick up another substance of abuse, the addiction continues on. So we need to address all of them as a package.
Well, it sounds like you kind of were getting to this, but does the program address the underlying drivers or roots of addiction?
Yeah, we know that 80 to 90% of people who go down the path of addiction begin prior to the age of 15 or 16. So we know that in general, addiction is a problem born in adolescence. And so when we look at what are those factors, there's a variety of those, but they start with attachment, an attachment style very early on, 2-3 years of age. We have trauma, we have adverse childhood experiences, we have other co-occurring disorders. So while it creates some complexity in this program, it also brings some truth to this, that there's a variety of factors that this program, you can go on and watch some videos and get some content to understand what these drivers are. And once you understand them and identify them, then we have interventions and we have treatments and things that you can actually do to address these. And in some ways that leads to these long-term outcomes where people then can drop the addictions. They don't need them anymore because they've identified these underlying drivers.
So how do you know it works? Do you have any success stories?
So, yeah, so John, maybe, I don't know from the New Mexico version because you've been running it a lot longer, but what I will say, President Peterson, is that we are using this as a part of our care here at the CBS Healing Center. So when we meet with a client and tribal citizen, program participant, and we identify substance use as an issue, we do include Culture Heals as a part of the treatment planning. And so does our reentry and recovery program. Every individual that lives at our non-congregate shelter is expected to sign up and have an account with Culture Heals. So, there's no data. We're still so new. But what I will say is we do receive feedback from people that are using it, and feedback that, that it's good and that they are able to explore themselves to understand their experience so that they can seek help, and certainly the family members as well.
The other thing I'm sorry, go ahead, Lisa.
I just had a client that really made my day when she said, this was just what I needed. And it was such a relief to hear her say that. So
the other thing I wanted to add is when you said, does it work? I think one of the things that this platform really, in terms of meeting people where they're at, not only is it for people who want to address addiction in their own life, we have an entire part of this program dedicated to people who are trying to help a loved one with addiction. And that's based on this community reinforcement and family training approach. And we know that that's the best evidence-based platform we have for helping a loved one with addiction. That is all included into this platform, so people can go on and get access to that. And we have 20, 30 years of data to show that that's the most evidence-based way to help people get into treatment. That's part of it. The entire platform has been built on what's known as the contextual model, which is an evidence-based model for change. I won't get into the details, but a lot of that model is included when people watch videos. They'll learn more about that. And we are right now working with a group of researchers to collect data and to look at outcomes. We know that that's really important. To be able to show how does it work and what are the outcomes that we're getting. So we will continue to be working on that.
Can physicians or prescribers of addiction medications and other healthcare workers refer patients to this cultural heals?
I hope they do. I think that absolutely. I think it's a wonderful use of this platform where we know that addiction medicines, whether we're talking about buprenorphine, methadone, naltrexone-based medications, that they're very, very effective at helping people, particularly when the brain gets really hijacked. But medications alone don't heal addiction. It couldn't be better said as culture is what heals, not a medicine. Medicines can help, but you need the cultural piece. And this platform for people that are prescribing medicines, they can use this platform. Dr. Woods, you might want to add some more to that.
No, I think that was a great answer. And that's why this platform must be paired with our CVS Healing Center and Protocol crisis hotline, because it really takes all of us to hold each other up. And there's no one magic bullet.
So is this program comparable to self-help programs like the 12-step and SMART? And so what are the similarities and differences?
Go ahead, John.
Sure. So, in general, there's a variety of self-help groups, and they're all work in a variety of different ways. This program works along with them. It's not, again, a substitute for self-help groups. In fact, it encourages people to join self-help groups, whether that would be 12-step type programs like Alcoholics Anonymous or SMART recovery programs. There's a variety out there. This platform, again, is not meant to be to take the place of those. In fact, what we really push throughout this program is that relationships is what heal. And so in some ways, this platform really in some ways can educate people that are going to self-help groups, and they may be talking about a variety of things, but the platform can actually help people take a deeper dive in understanding other addictions, understanding those underlying drivers that often don't come up in some of these self-help groups. So I see them working really, really well together. Again, that people who are in self-help groups should really be able to utilize this platform in a huge way. And people on this platform should be encouraged to use self-help groups. They're a wonderful tool for healing, and they connect us up within our culture.
And the thing I'll add there is that the key around this platform, Dr. Fitzgerald nicely stated, is this isn't another program to replace anything. This actually is a platform, and we're going to continue to refine it. And it really is meant to be a place that our people can come and find help, because every single human being is uniquely different. Their doorway is going to be different. Some people can stop cold turkey. Some people can go to self-help AA and find healing. Every human being is going to find healing in a different manner. And so this is supposed to really promote the fact that healing takes place in really exploring and connecting with others.
Great. Can you tell us about the New Mexico 5 Actions program and the connections there?
Yeah, so what happened was when I was first building this program and going into a studio and creating videos, I met the CEO at Protocol, which was Phil Evans. And at the time, I didn't know much about what they did, but they were one of the largest crisis call centers in the United States. And when I toured their facility, I had a light bulb go off that if we could connect the phone support, the human touch with the digital health platform, we would really have something special. So Phil and I talked about that, and he shared in that vision. They had, at that time, been doing the phone support, the crisis and access phone support for the entire state of New Mexico. And when the state got some opioid treatment grant money, some of that money came through protocol. And Phil called me one day and said, hey, would you like to use some of this to finish your platform? And we could launch this in the state of New Mexico. And so I flew out to New Mexico and met with a variety of people in the Behavioral Health Services Division. And that's really how this program got started. They were willing to support it. And I've been grateful for that state as well to have this opportunity to build this platform.
So can you tell us a little bit about who developed Culture Heals?
I would say that's a collaboration. I may have gotten things started, but this program never would have happened without Dr. Woods, without Lisa, without the community of people coming together. I'm going to turn this over to you, Dr. Woods, to talk about sort of how this all came together.
I think just keeping it brief, pass the buck to President Peterson and our leadership of meeting tribal citizens where they're at, being creative, being not saying we can't, but how do we? And so Culture Heals is a result of absolutely a partnership.
How long does a person who has access to the program, and how long does it take to complete the program?
It is a self-guided journey. And so somebody can gain access today. Right now, people can log on, sign up for free. And it's a private platform. That's your information. And it depends on how fast you want to go through that journey. And so, there's over 100 modules, learning about anything from genetics and, adverse childhood experience is anything related to addiction. And so the Alaska collection really touches on the roots of, I always look at addiction and many of the social issues that we face disproportionately as Alaska Native people as symptoms of something much deeper. And that much deeper is acknowledging our past and acknowledging the historical and intergenerational trauma, and which really promotes why we have to acknowledge that our culture is what kept us healthy and is what healed us. And so Culture Heals is meant to explore the disease of addiction, but never forgetting that this is a symptom of something much deeper.
Do you have to be enrolled as a client to access the Cultural Heals program?
You do not. And we want to encourage anyone and everyone to participate, providers as well, because for providers, this is a powerful engine to be able to tell a client to watch a module and then to come back and to process it and to lead them to their healing. Or a family member who is watching a loved one struggle and finding the words or support, such as John mentioned, the craft model, to be able to find, because as Native people, we heal collectively. We heal through relationship. And a part of that healing, it comes from our culture. In addition, we also have to understand the disease that we're facing. And so, but that does not define us as people.
So do you have to be a tribal citizen to utilize these services?
So within our CBS Healing Center, this is built upon, our tribal services. However, we treat families. And so if somebody is married to a non-tribal citizen, we treat families. And so, this is a free program provided by Tlingit and Haida. And, we welcome people to sign up and to learn. We want to heal our communities. We want to heal individuals. We want to heal families. We want to heal our communities. We want to teach others about using the language that addiction and the social ills are symptoms of something much deeper. We want to promote resiliency. And so we want to do this together. So yes, if you're interested in wanting to learn more and you're not a tribal citizen, sign up.
So for people seeking care, what is the best way to make an appointment?
Yeah, so our main number is 463-7305. That's one way to make an appointment. We also have our behavioral_services at Tlingit and Haida. And you can email and we can assist you in that manner. Or you can go to the CBS Healing Center website, and a quick way to get to that website is to go to the main Tlingit and Haida website, and there is a icon on the front page that you can click on, and you can actually submit a self-referral through the website, and we get that. We check those throughout the day, and again, while we do have a wait list, we have a crisis on-call clinician available Monday through Friday.
Great. What other contact information can you share with us?
So we are located downtown Juneau at the 320 West Willoughby. There's our operation, hours of operation Monday through Thursday, really Monday through Friday, 8 to 4:30, we are here. We also promote the care line. This is the Alaska Care Line. It's the suicide hotline. However, it's also a hotline that has really transformed into someone to talk to. So we do promote that statewide. And then after hours, if you call 463-7305, it goes directly to our crisis hotline.
Great. Well, thank you so much. I'm going to turn now to some of the questions we got online. I think a lot of them have been answered, but I'm going to try to get to a couple that maybe they hadn't. Is there anyone helping those dealing with the loss of a loved one who passed from alcohol or drugs? And that's from Georgiana Smith.
So President Peterson, the question is there anyone that can help somebody with the loss of a loved one to addiction? Is that correct?
Yeah, alcohol or drugs, yeah.
Yeah. I would say definitely call our healing center, and we have healers on staff that have held space for individuals that are suffering from such, so they can contact us.
So from Don DeGuacqua, is this only for addiction, not mental health?
So while the focus is on addiction as a package, we do holistic care. And so if you go onto the platform, I'll just use adverse childhood experiences as an example. Adverse childhood experiences, and those childhood experiences lead to mental health issues such as anxiety and depression, which go hand in hand often with individuals that are suffering from addiction. So for me, I cannot see things separately. So what I would encourage people is to sign up and to learn and to contact us if you want to learn more and you're not finding it on the site, because that type of feedback also helps us to continue to refine and to add new materials if that's something that people are looking for. John, do you have anything to add to that?
I think that's right on. I think we do have a lot of content on mental health in the platform. As you said, adverse childhood experiences, but we also have a lot of content on trauma, and we have videos on co-occurring disorders. The idea that mental health and mental health issues often and addiction issues go together. And when you get to the videos and the content on sort of the pathways of wellness and the interventions, there is content in there specifically that's useful for addressing mental health issues. We have a video on psychiatric medications in addition to addiction medications. So yes, there is absolutely content on mental health. I think addiction is kind of the doorway into this broader content. And as Dr. Wood said, if there are things that viewers would like to see on that platform, by all means, this is an ongoing collaboration.
I saw several folks asked about detox. What can we do to help people who need to detox?
The way I would answer that is, and I'll give an example, Whereas somebody was ready, but they were living with a lot of shame. They actually called our hotline. We contacted and did a warm handoff to the proper services that provides it here in town. So if somebody is wanting detox, I'm going to go back to, while we can't do certain things here at the CBS Healing Center, our partnerships are incredibly important so that we can do warm handoffs and we can do case management. So hopefully that answers that.
So what from Kathy Mills Marvin, what about ADHD, schizophrenia, depression, and how about our help for the caregiver? It takes a toll on us, feel like we are losing it. Are there recommendations for someone seeking care?
100%. So first of all, with something like, let me just take ADHD, just to share some of the services we provide here at the CBS Healing Center. We do have psychological testing to properly diagnose somebody who might have a diagnosis of ADHD. We don't do medication management. However, we can refer out. Again, we can do warm handoffs. We can do proper diagnoses, including psychological testing, and then do a warm handoff. If somebody is experiencing psychosis and they come to us, we can address their needs. And again, if they need higher level of care, we can properly refer out. When it comes to secondary trauma, burnout, some of the things that we experience as providers, certainly here through the CBS Healing Center, we always remind ourselves we are the clients. Mental health and substances don't discriminate. All of us at some point in time also need to seek the help that we need. And so I just encourage people that are in the field and feeling burnt out, you can contact us. If you're a tribal citizen and you need some support and you need us to hold space for you, you can contact us.
That's great. I'm really impressed with the questions today, and people are really, passionate about this. I think we got to most questions. If we didn't, we'll make sure to go through and get back to you. Last question, is it for adults only?
So, John, do you want to put any discretion on age?
We have not. When it was developed, it was being developed with adults in mind. Adolescents have a variety of challenges that I think in some ways the platform doesn't address. But that doesn't mean that what our experience has been in New Mexico is that people, it's not really about age. It's really about motivation of people actually on the technology. We've had 13, 14, 15-year-olds go on and watch these videos. And so I would say, in general, it's been developed for adults, but Tina, I'm going to kind of let you add into that. I would not want to not motivate adolescents or younger teens that want to learn about this stuff to not go on the platform and learn about it.
I concur. It's I don't even have anything to add, John. I would agree with you.
And the only thing I would add is that, again, this platform was never envisioned to be developed without the human connection and the phone support and the connection to the community behavioral services. So even if an adolescent goes on there and they are suicidal or there's something there that's significant, the whole idea is that the platform helps move them in the direction of making a phone call and connecting to people. As we started this webinar, people are dying. We know that. Way too often, and we have to do everything we possibly can as a community to pull these platforms and all of the traditional treatment stuff all together in a way that people can access through a variety of doors and get their needs met. We simply don't want to shut anybody out.
Well, thank you guys so much for this. It's hard to really cover everything in 1 hour, but I think this is a great introduction of what it is we're trying to accomplish. I think it's important to say, we know it's not enough. Whatever we do is not going to be enough, but we have to start somewhere. And it's something, that we're going to grow and build. we know in our future are going to be physical rehab facilities. We know there's a need in abundance, so we're beginning the work. That's all we can do. We can't wait for perfect to get started on everything. So I just want to thank you, Dr. Woods, Dr. Fitzgerald, Lisa. The work you're doing, you lead with your hearts, and it's something I'm incredibly proud of each of you for being a part of this. So again, I just thank you. Our door prize winners this week are Lucy Cake and Aaron Fitzgerald. If you will message us your addresses, we'll make sure to get you both one a hydro flask. We'll get those out to you. We are back with our lunchtime chat, so please stay tuned and tune in for others. I think our next lunchtime chat will be on our reentry and recovery work, which is, it's all really connected. So, we know that we're trying to be the change that our people need, and again, to meet our people where they're at. So we'll see you all at the next lunchtime chat. Stay tuned to our Facebook page, and more information will be coming soon. Thank you all. Be well.